How did you feel after she said that?
Poorly. It was anyone in that position. It's quite a letdown. You look to nurses and doctors and other caregivers to be more positive about things and to offer you hope.
Yeah, hope.
Hope is the word. And she just she blew it.
Did you feel like you were treated as an individual when you were in the hospital? Were you advised? Were you told what was going on for the most part? Were there times that there was lack of privacy, or what about some of those issues?
Again, I hate to single out intensive care, but there it is quite intensive, of course. I think there were times in that room where I think my privacy was compromised somewhat by just the fact that I'd leave the curtain open to the room, and there were people outside talking about whatever they wanted to talk about.
How did that make you feel?
Well, I felt rather exposed. I thought it was a lack of privacy that I thought I should have been afforded in a private room. I just think it could have been handled a little better. I was in the center of things physically, in so much as the room was in the middle of everything, and perhaps they couldn't help but have a place to congregate right in front of the room. But
yeah. So it sounds like there was an inappropriate placement for their discussions. So it would have been a confidentiality issue for one, of what was being discussed. You could overhear anything, as well as as you mentioned earlier, humility of lack of privacy and some of your basic needs. What experiences have you had with caregivers that you really felt were done well?
My main nurse in intensive care was the most giving, caring, at least to someone in my position, most giving, caring person I'd ever run across. I honestly felt as if she enjoyed what she was doing.
What was it that was so good about her? What did she do right?
Well, something as, I shouldn't say as simple as a bedpan, but to let somebody use a bedpan and do it in a way that wasn't quite so embarrassing as you might think, by arranging blankets and towels and so forth, so that even if the curtain were open, it wouldn't have been a problem. She just was genuinely interested in how I felt about things.
You had also talked about how you had developed some kidney problems because you had been told that you needed to drink water, a lot of water, and you ended up not really taking it as seriously as you might, but probably because you weren't given enough information. Can you share a little bit about that experience?
I just didn't drink enough water to stave off that second bout with dehydration. And had I listened to the nurse and other caregivers ahead of time and taken that warning seriously, I might not have been in that situation.
I think what was lacking, though, was the fact that when you were told to drink water, you were not told what could happen if you didn't. And do you think it would have been different if the caregivers had shared with you that without drinking adequate amounts of water, you could end up with kidney failure?
Absolutely. I think if had I known the consequences of my lack of compliance, I probably would have had 3 or 4 gallons a day.
Yeah. So the importance of letting people know why we are requesting them to do this or that is equally as important as telling them what to do.
Right. Very true.
Finally, Mark, I'd like to ask if you could share with new students coming into the healthcare field what advice that you might have for them caring for patients with cancer.
Well, besides the obvious empathy, I think the most important thing is to listen to what the patient is really saying. As we talked about, many of them may feel isolated from the rest of the world given their disease, and one of the things that is quite important is if you have any symptoms at all, be it something from a sore throat to a case of constipation, this should be brought up so that the caregiver is aware of it, can pass it on to whoever needs to make a decision about it. Caregivers, I would guess, should be cognizant of their own health. So if they have perhaps a respiratory infection or something along that line, recuse themselves from the situation where they might come in contact with someone with an immune system that's somewhat compromised. They should also be constantly washing their hands. I think that's a small thing, but it can help alleviate any number of problems just from carrying germs around on hands. I'm sure we all be amazed at what we carry on our hands. I think as a cancer patient, we feel different than everybody else. Now, whether everybody else feels different than we do, I don't know if that goes both ways. I just think people regard those with no hair or a PICC line coming out of their arms or some other accoutrement that's on their body that normally you wouldn't find. I think they're all regarded as something just a little different. And I think that caregivers should concentrate on treating them as people, just like you and I. We're all people. We have a disease. It's unfortunate, but treat us like people and we'll all get along just fine.
Thanks for your time, Mark.
Anytime, Kathy. I was glad to do it.
In conclusion, many types of cancers can now be cured or controlled. Patients with cancer can experience a good quality of life. Healthcare workers make a difference in the lives of patients with cancer.